Hi, everyone. Thank you for joining this module series centered on supporting youth through transitions from hospital to school settings. This module series focuses on understanding and equitably supporting our students that are navigating significant behavioral health challenges and mental health crises that often lead to psychiatric hospitalizations or outreach for intensive services. Drawing from the research, we are going to provide an overview of the reasons why students are commonly hospitalized, the types of support often received in these settings, student and family perspectives on these experiences, the role of school in this process, and the development and implementation of the hospital to school transition protocol, which we hope will be helpful and useful for your school communities. Before we start formally, I want to introduce myself. My name is Catherine Kurtz. I'm the project director of the BIRCh project and a school psychologist by training. I would also like to introduce the BIRCh project to those of you joining us for the first time for this module series. The BIRCh project is the Behavioral Health Integrated Resources for Children project. Its mission is to provide professional development and resources for schools and to strengthen the coordination of behavioral health supports across school and community agencies. The BIRCh project is led by faculty members from UMass Boston and UMass Amherst and is sponsored by Boston Children's Hospital. For more information, please check out our website at umb.edu/BIRCh. All right. So this is the phenomenal team of individuals that dedicated their time, minds, expertise, and passion to developing the hospital to school transition protocol. This project would not have been possible without their strong commitment to supporting our students and aiding our school communities in this work. There are also a number of stakeholders throughout our state that have lended their expertise and experiences to inform this project. And we'll forever be grateful to them for their commitment to improving outcomes for youth. We would also like to provide ample acknowledgement, credit, and recognition to these three phenomenal organizations that have led much of this work in thinking critically, comprehensively, and equitably about meeting the diverse needs of students and families navigating these challenging experiences. To enrich your learning and knowledge of developing and implementing these supports, we strongly encourage you to look at these exemplars and leaders in the field. After viewing this webinar, we hope that those of you engaging in learning it with us today will gain knowledge in the trends, contexts, and perspectives of youth and families that have experienced psychiatric hospitalizations or behavioral health crises, as well as the role of school in supporting students as they transition back into their homes, communities, and schools. We hope to provide knowledge and insight into what went into the development of the hospital to school transition protocol. Lastly, we hope to orient each of you to the systems and procedures that can support implementation of the hospital to school transition process. Let's get going. So as we engage in this module together, we would like to center our experiences as educators in the experiences of our students and families. To deepen our learning, please take a moment to reflect on a student you have worked with or several students along the way that have persevered or struggled to navigate mental health challenges. On this slide are 4 case study examples of students ranging from elementary to middle to high school that may or may not parallel some of your experiences serving students. After concluding with this introductory module, we encourage you to engage with the case study modules that will provide an opportunity to ground you in your knowledge of the hospital to school transition process and ways in which the hospital to school transition protocol can be implemented and integrated in your community to support your students, families, and educators. Let's explore some trends in psychiatric hospitalizations for youth. An increasing number of students are hospitalized each year for psychiatric crises, such as suicidality and eating disorders, as well as psychosis, substance abuse, and mood disorders. As with our case study examples, students experiencing these behavioral health challenges vary in age, grade, culture, and background. Similarly, the reasons for hospitalization are diverse, with varying types and levels of support needed. It is critical that we acknowledge that many students in need of hospitalization do not have access to higher levels of care. And for those who do, hospitalization can take many forms, from spending several hours or nights in the emergency room to inpatient residential care. While hospitalized students typically undergo crisis response procedures to ensure their stabilization and immediate safety, they then will often experience psychiatric assessment and treatment planning in the hospital, which will vary based on their needs. 78% of hospitalized youth experience at least one medication change, and approximately 23% are prescribed over 3 medications from different drug classifications. Treatment in the hospital can take the form of one-on-one formats, peer groups, family therapy, and utilizes different intervention methods such as cognitive behavioral therapy, family psychoeducational therapy, and many others. On occasion, students will also participate in education supports, depending on their hospitalization setting, the program itself, and their length of stay. What do we know about access and equity in supporting children through a mental health crisis? Statistics from 2019 suggest that while approximately 500,000 children per year visit the ER due to a mental health crisis, less than half are discharged to a psychiatric facility, and 80% of adolescents in need of services do not receive them. Treatment rates are disproportionately lower for youth of color, with the lowest among Black and Hispanic youth, and those from low SES backgrounds. In addition to hospitalizations increasing and length of stay for treatment decreasing, which is indicative of shortages in boarding capacity, there are discrepancies in the availability of hospital and community-based resources based on community factors, such as geography, including rural areas being less likely to have hospital-based services, racially and ethnically diverse communities being less likely, these communities being less likely to have access to community-based youth services, and communities with lower insured rates are less likely to have services available for youth. The pandemic state of this country has intensified the need for students and families and exacerbated existing inequities. With limited follow-up care, students often return to school within 5 to 7 days of experiencing a crisis or shorter. Among these students, up to half are rehospitalized within a year, and most often within the first month they're back in school. There are a number of contributing factors that can increase a student's risk and vulnerabilities towards rehospitalization. These include treatment factors such as students with shorter lengths of hospitalization and lower rates of access and utilization of high quality aftercare services following hospitalization. family factors such as low perceived family support, limited knowledge of educational and mental health services, and being of a lower socioeconomic status. Student factors such as students with more severe conduct challenges or unsafe behaviors, developmental and learning disabilities, students that were first hospitalized at younger ages, and students with a history of abuse. Considering these factors and the disproportionate ways that they can impact certain marginalized groups of students, supporting students that require this level of support is an equity issue. With an acknowledgement and recognition of these challenges and the inequities and adverse outcomes that these vulnerable students can face, that leads us to the question of how can we disrupt this cycle of students repeatedly experiencing and entering into high-risk crisis situations? How can we best divert the trajectory towards equipping students, their families, educators, and the system with the knowledge, procedures, structures, and tools necessary to navigate these challenges in a collaborative and supportive manner? We deeply recognize the need for more services and higher levels of care options for youth, and more integration and coordination across systems as a long-term goal for our state. What we know from the research is that high quality and coordinated aftercare services are one of the most powerful strategies for preventing further psychiatric challenges. Schools are often the gateway and home for student access to mental health services. And despite this, we know that at this time, many of our school communities do not have the systems and resources to comprehensively meet the needs of those vulnerable students and families. To deepen our understanding of how to meet the needs of students and to build our capacity for our systems to respond to student needs, we want to center the voices of our students, families, and educators as they experience behavioral health challenges. Students report that they are often managing stigmatization, difficulties navigating how to disclose their absence or crisis experienced to friends and teachers, worried about falling behind in their academics, anxieties around family stressors, and difficulties continuing to manage mental health symptoms and apply what they learned as they leave the hospital setting and transition back to the realities of the real world. The individuals closest to our students, their families, their guardian, caretakers, also experience significant challenges, such as difficulties accessing educational and mental health resources, with their child's needs having risen to this intense level of needed supports. Families often report receiving low social support and feelings of disempowerment. As you might imagine, they also have fears about child symptoms, recovery, and safety. It is also reported that families often lack access to high-quality psychoeducation. And all of this is compounded by financial stressors, such as missing work to care for youth, cost of care, and other factors. Hospital and school staff and teams also express barriers around navigating the hospital to school transition process. Hospital staff often report difficulty knowing who should be their primary contact at the school, and concerns regarding protecting the confidentiality of the student and families and disclosing sensitive information. There are also limitations regarding educational systems and services and overall time and resources available. Similarly, educators report a lack of knowledge of guidelines and procedures for supporting students and families in this process. There can be a disconnect between the type of information provided by the hospital and its relevance and feasibility for implementation in the school setting. Similarly, educators may not be aware of or have the capacity to connect students and families to the needed community support services and resources. It's important to think about how this process fits within your existing multi-tiered systems of support framework to avoid duplicating systems or creating unnecessary work. System structures and procedures to support students and families through a behavioral health crisis requires collaboration from all team members, a commitment to valuing all perspectives and all voices, and a willingness to monitor progress, revisit plans, and make modifications or adjustments to ensure student success. To address this need, the BIRCh team engaged in a collaborative process to develop a comprehensive tool to help guide the transition process for students returning to school following a psychiatric hospitalization. Beginning with a review of the research literature, the BIRCh team identified the essential needs of students, families, schools, and hospitals through various phases of this transition. In the next stage of protocol development, a series of transition protocols and procedures from districts across the country were collected and reviewed using a comprehensive vetting tool that evaluated the following areas: applicability to K-12 settings, approval by a school district, legal defensibility, integration into an MTSS framework, promotion of equitable access to services, cultural responsivity, comprehensiveness, clarity and simplicity, and recency of the tool. This same vetting tool was utilized to evaluate the current hospital to school transition protocol for these elements. This protocol drew upon the areas of strength identified from the collection of diverse resources reviewed and from the best practices identified in the literature. A team of school-based providers were asked to review, critique, and provide feedback to further inform the refinement of this tool and improve its feasibility and usability in the school setting. Components of the hospital to school transition protocol were drawn from exemplar models, such as that of the Loudoun County Public Schools Return to Learn guidelines. If teams are interested in learning more and accessing the resources that inform the development of the current hospital to school transition protocol, please refer to the resource list at the end of the hospital to school transition protocol available on our website. Here's an overview of the main components of the hospital to school transition resource. The protocol includes primary sections for documenting the members of the team and student and family demographics. IEP 504 considerations are also included, along with sections to guide reintegration into the community, academic, mental health, and behavioral support plans for the student. As we know, student and family voice are central to this process. So elements for collaboration, communication, and supports for the family are also included. The supplemental documents for the protocol consist of more detailed guiding questions for teams to collaborate on to facilitate comprehensive and responsive teaming and planning throughout the transition process. For example, the family handout consists of a summary page of the members of the student's school-based team, follow-up meeting dates, as well as the main components of the student's plan for returning to school to improve consistency across stakeholders. All of the information on the family handout is intended to be accessible and relevant for families and to decrease stress and confusion around this process. The following slides provide an overview of the hospital to school transition protocol. We invite you to download the resource for an overview of the supplemental documents as well. Let's talk a little bit about implementing the hospital to school transition protocol, and much more detail is provided in our modules around the case studies. The hospital to school transition is positioned as a comprehensive data-driven process of teaming, planning, and collaborating. This diagram provides a timeline and procedures that may be used flexibly or adapted to align with your school's procedures, timelines, and systems for teaming, planning, monitoring, and evaluating student progress. Within this framework, the process is broken down into a 10 to 12-week timeline of supports for the student. The phases of support include planning and preparing for the student to transition back to school. In the planning stages, the team assigns a lead to coordinate and organize efforts to support the student, collect existing student data and records to inform the process, and collect and contact essential information from the family and hospital staff with appropriate releases of information. In the next phase, a welcome back meeting is conducted in which the team, including the student, if they're of appropriate age, the family, school-based, and hospital-based providers begin discussing strengths, needs, supports, services, and school-based interventions as outlined in the hospital to school transition protocol. The school team may reconvene following this initial meeting to more thoroughly outline key point personnel responsible for intervention implementation, progress monitoring, and evaluation. The following diagram outlines suggested recommendations for completing the hospital to school transition protocol and supplementary documents. This is meant to illustrate one example of how this tool can be used. The aim is that this resource is adapted to best fit the context of the schools utilizing it. School teams can adapt and should and align these procedures and documents with the systems that exist in their school to avoid duplication of efforts and improve efficiency. This protocol integrates multiple elements of recommended practice guidelines for school transition post-hospitalization. It should be noted that many students in need of hospitalization do not have access to higher levels of care. And for those who do, hospitalization can take many forms. We also acknowledge that various stakeholders will come to this process with different viewpoints about where to start the conversations, the aspects of the process that should be prioritized, and what support should look like over time. This is challenging work, which requires collaboration from all team members, a commitment to valuing all perspectives and all voices, and a willingness to monitor progress, revisit plans, and make modifications or adjustments to ensure student success. We recommend this tool be utilized in the manner that is accessible to students, families, and school teams, and in a manner that is most responsive, relevant, and feasible for your school community. The formatting, structure, and language of the documents can be modified to ensure that they would be more culturally responsive to the needs of your school community. We acknowledge that supporting students and families through a behavioral health crisis is challenging work and by no means a linear process. We believe that in coming together, we can improve student outcomes. Teaming is an integral part of supportive student hospital to school transitions. With that vision in mind, it's important to consider the systems and policies that exist presently in your school. These can serve as building blocks to ensure that this process can be approached in a manner that is feasible and sustainable. Suggestions for where to start include providing education and training on this topic to deepen our understanding of this process as an issue of equity. For example, schools may find it useful to hold a training to ensure that school staff understand that behavioral health crises can take many forms, and there are often structural and systemic barriers to accessing higher levels of care. Other school teams may start with a focus on teaming, ensuring that there is an individual or team assigned to coordinating students returning after a behavioral health crisis. Teams can also consider how to align this process with existing crisis procedures within their school, as well as how to evaluate the effectiveness of their current plan. To engage in more learning on supporting the hospital to school transition process, please feel free to view one or more of the 4 hospital to school case study modules corresponding to this webinar series to provide practice opportunities in applying the protocol. Again, as we mentioned, this tool should be utilized in the manner that is most responsive, relevant, and feasible for your school community. The BIRCh team recognizes the limitations of and the negative impact language can have on perpetuating inequitable systems. Feel free to rename the titles of the documents and make other adjustments in language throughout the protocol if your team feels it would be more culturally responsive to the needs of your school community. Please complete an evaluation of this module by visiting the link on the slide. We would greatly appreciate your feedback. Thank you for viewing this module to learn more about supporting students who are transitioning back to school from psychiatric hospitalization. We want to thank you for your time and attention to the behavioral health needs of students. At our website, you can sign up for our subscription list to get more information on best practices, such as supporting the hospital to school transition process. We would love to hear from you. Please reach out to us with thoughts or questions. We hope you view the rest of our modules on the hospital to school transition process as your team is building your capacity for supporting students with intensive behavioral health needs. Please take care and thank you for all the work you do to support our youth.